Good morning, everyone. Today we have all assembled here to have a small discussion on the hematological aspects, hematological disorders, which we see commonly in our day-to-day practice. So, we have with us Professor Maitreyee Bhattacharya, who is a hematologist by profession, and also we have Dr. Jasashwi Chakraborty, who is also a hematologist by profession. And I am Dr. Tanmoy Kr Mondal. I am a medical oncologist by profession. So hematological cancers are the cancers which begins in the hematological precursors like the RBCs, WBCs, and the platelets, which we see. So the common hematological malignancies are the leukemias, the lymphomas, and the myeloma. These are the common malignancies which we see. In India, also it accounts around 9.5 to 10% of all the cancers in men and around 5% in the women. And what we see that it has been seen that it affects the children's also very commonly, and it's a serious concern for as a public health administrator also in India. So there are certain risk factors what we need to discuss and other things also. So first, my question to Madam is: so what are the risk factors for the development of blood malignancies which we see?
uh, like other malignancies like solid cancers, it's not very well defined that these are the risk factor, like all of smoking, tobacco chewing, this will lead to oral cancer, lung cancer. So this type of definite cause effect relationship is not defined in case of blood cancers. One malignancy, chronic lymphocytic leukemia, there is a familial predisposition. So if there is one person in a family with CLL, so there is a chance that other person will develop. But other factors which are more commonly associated with blood cancers, like radiation, use of any chemotherapeutic drugs, like many drugs are used for benign causes also, like methotrexate is a drug, cyclophosphamide used by the nephrologists, methotrexate used by the rheumatologists. So various drugs which all the population is predisposed to malignancy. There is a proto-oncogene. So once it gets activated, it become manifest like leukemia. So these are some of the risk factor: radiation, various chemo, some viral infections also, especially for lymphomas. And viral infections are important cause of lymphomas in this part. Epstein-Barr virus, hepatitis C virus, this can lead to various types. And immunodeficiency status. If there is a immunodeficiency for long time, autoimmune disorders like SLE, rheumatoid arthritis, they are more prone to develop hematological malignancies. And we have series of leukemia patients also who basically were suffering from SLE. So these are the risk factor, but there is no direct cause effect relationship.
Yes, like solid tumors, we don't have specific type of risk factors which we see in the hematological malignancies. That's commonly seen. So next is that anemia. Anemia is one of the very common causes in India, which we see that many patients suffers from anemia. So are all anemia dangerous? So Dr. Jasashwi, are all types of anemia, are they all dangerous, or the question can be framed in such a manner that are all anemias stamped as a hematological malignancy?
No, not at all. Definitely, anemia is one of the manifestations of hematological malignancies, but not always. Anemia can have many background. The particular thing which we want to emphasize is that we should always search for the cause of anemia before treating it. Because in India, especially, we see that many of people of anemia are getting repeated blood transfusions, repeated iron therapy for a long time without searching the cause for anemia. And later on, when the patients come to us, we search for the cause and we find something else and we treat it likewise. So, all anemia should be investigated to find the cause, and then we should treat the anemia according to the cause and not blindly.
So does donation increase the chances of blood cancer development or anything? This is
No,
a
there
myth. This
is
is a
this
myth.
complete. It's a complete myth. There is no chance of having blood cancer by blood donation. Rather, we should always donate blood, because when we need blood, blood is not manufactured in a factory. If you don't donate, you will not get blood. As simple as that.
So, madam, next is that leukemia is one of the very common disease which we see mostly in children, also in adults. So the symptomatology, how does a patient of leukemia commonly presents to us?
Yeah, leukemia basically is a broad term. Like there
Huh.
are chronic
Acute,
leukemias and
and
acute leukemias, and symptomatology also varies. In
varies.
case of acute leukemia, it's very short duration. Problem starts when the patient will come to us. The history will be of 3 weeks, 2 weeks, sometimes even days also. But chronic leukemias, it may be in months also. Even sometimes in case of there is one leukemia, chronic myeloid leukemia, it may be in years. The patient was having some problem, maybe he or she neglected. So, but initially at the very beginning, sometimes the symptoms are not very specific initially. Like patient will have a fatigability, maybe a low grade fever. Patient will have some bleeding from the gum while brushing. These sort of symptoms often patient neglects. They think these are very benign. This may not be the benign. After a few days, the patient will have very high rise of temperature, severe bone pain, appearance of spots all over the body. So that time patient has advanced. So patient often comes to us late because initial symptoms they are mild. And this is for in case of acute leukemia. In case of chronic leukemias, the most common leukemia chronic is CMN. So patient usually have only thing is a fatigability, not well, I'm not well. For that patient goes to physicians like that, and it's attributed to blood sugar, blood pressure, thyroid, anything else other than blood cancer. And sometimes the spleen enlarges, so they have a feeling that whenever they take some amount of food, they are satisfied. They can't take much more amount of food, and the dragging sensation also, some sort of upper abdominal discomfort. So these are the main symptoms. But what I'll emphasize that in case of acute leukemia, even hours are important. So once you have any symptoms which you have not suffered from before, so you should visit a hematologist to just get it confirmed that it's not a leukemia. I'm not saying all these symptoms are specific of leukemia, but it should be ruled out.
So yes, the main point is that we should reach to the hematologist as early as possible, because every hour or every minute matters in case of an acute leukemia. Mostly in a case of acute leukemia, it's very important. So next, Dr. Jasashwi, is the symptomatology of a lymphoma, how a lymphoma patient presents.
So basically, the term lymphoma, it means that the malignancy is originating from the lymph nodes. So we have some nodular structures which are usually not felt. We have it around our neck, we have it in the armpit, we have it in the groin region, and there are some similar structures which is inside our abdomen, which we obviously cannot feel. Now, in case of lymphoma, when the malignancy is originating from the lymph nodes starts getting increased in size. So you may feel some nodular or globular swelling in your neck region, in your groin, in your armpit, and that will be gradually increasing in size or number. It may so happen also that its lymph nodes are originating in the abdomen, inside your abdomen. So when they are growing in size, they will be compressing some part of your gastrointestinal tract. And you might be having early satiety, you might be having problems like constipation, you might be having bleeding from your GI tract in forms of blood, vomiting in forms of blood in stool, like that. Along with this, we have got another medical term that is called B symptom, that is associated with lymphoma. In B symptom, we include significant weight loss. That means 10% of your body weight within 6 months. We include fever that should persist for 2 weeks without any proper cause. And we also include another symptom, that is drenching night sweat. That the patient will be complaining, I am having severe sweating even if I am lying under the fan in full swing. So these are the B symptoms, some compressive symptoms, and obviously this nodular swelling. In those cases, we think about lymphoma.
So these are the symptomatologies of lymphoma, what we see. So next comes the treatment in general for any hematological malignancy. Treatment mostly includes chemotherapy, multi-agent chemotherapy in combination with multiple agents. Along with that, in radiation might be required in some patients who are suffering from lymphoma. And of course, if the patient relapses either in leukemia or in lymphoma, they might be candidates for a bone marrow transplant, either in the form of an allogenic or an autologous transplant. So this is in short regarding the treatment. Next question is, when we are getting treated for a leukemia or a lymphoma, many patients develop many symptoms, and we need to take care of ourselves. So how do we keep ourselves protected during the time of ongoing chemotherapy, because all the patients are immunocompromised at that point of time. They need to be aware of the food habits, the
Yeah.
precautionary methods,
I
the
think
lines.
what Dr. Tanmoy has asked is very important. Like leukemia patients, they die of either infections, mostly infections, or a bleeding manifestation. So this leukemia treatment, we have two parts. One is specific chemotherapy, another we call a supportive care. Supportive care is basically to combat the side effects of this chemotherapy what we give, and this is the most important part. What the doctor and the patient should stick rigidly to this protocol. So one important is that whenever we'll give chemotherapy, that these chemotherapeutic drugs will not kill the cancer cells only. They will kill the normal bone marrow cells also. So there will be drop in hemoglobin, drop in WBC count, drop in platelet count. So WBCs are most important for protection against infection. The patient usually initial part patient become worse once a chemotherapy started. Like if patient was okay before chemotherapy, after that patient was having fever, infection. So we'll have to prevent this basically. So once the WBC count is low, if it's less than 500 neutrophil count, we call it neutropenia, and if it's less than 100, it's dangerously low. Then patient need a protective environment, specifically what we call a barrier nursing. Patient should be in a room where any person entering the room should have a gown, should wash his hands, all these things, should not touch the patient very frequently. So the doctors and the relatives are the most important cause of infection to the patient. They should use a mouthwash regularly, so that there are a lot of bacteria in the mouth, so that whenever normally we have the protection, we can prevent them to getting inside the body. But once the chemotherapy is there, they will cause infection. So after each meal, they should wash the mouth. Perianal region is also one area for this is a residence of the bacteria. So after passing stool, they should take a seize bath every times. And once the patient is in neutropenic, we sometimes use a prolonged course of prophylactic antibiotic. And any neutropenic patient, once the WBC count is low, any sign of fever, that should be taken very seriously, and patient should be brought to the doctor or to the hospital emergency immediately. Otherwise, it will be very late. It should be started within 1 hour. Other thing is that protection against the bleeding, because platelet count also drops. So they shouldn't use any toothbrush. While brushing, they should use the finger and not the toothbrush. So this can prevent the amount of bleeding. In case of female in the reproductive age group, we normally give hormone therapy, so that they will not be bleeding PV or menorrhagia. So these are the protection that should be taken, what we call a supportive care, while the patient is on chemotherapy.
Okay, so this is one of the main aspect, and the another aspect which we see while treating blood cancers is the availability of the blood products. And I think we should all this is an awareness related issue, so we should tell our the patients, relatives, and them also to promote more and more blood donation. So with this, I think your opinion on this, Dr. Jasashwi, the role of counseling the patients related for blood donation and blood product donation, because it's one of the major issues which we feel during treatment of any hematological malignancy.
Yes, especially during treatment of acute leukemia, we need a lot of blood product, like in form of packed RBC, in form of random donor platelet, or in some cases single donor platelet. Now, as also we have mentioned previously that blood is not manufactured in the factory. So unless you donate blood, you will never get blood. So once a leukemia patients get admitted, we always try to counsel the patient party that try to donate blood. It might help someone else, because you are taking someone else's donated blood. So in time of need, someone else will be taking help of your donated blood. So this is very important, and we also want to convey the message that whenever you donate 1 unit of blood, this blood gets separated into three components. One is the packed RBC, one is the platelet, and third one is the fresh frozen plasma. So basically, three patients are getting benefited by your single donation of blood. So please donate, and donate willingly and deliberately. Try to donate at least once a year.
So, so this is regarding today's discussion. So, the main crux is that we should be aware. We should reach early to hematologists, Leukemia and lymphoma are not incurable diseases. We need to know that these are curable diseases. It's not that it affects only the children and not any adults. It affects all the subgroup of people. And with this, I think we can end this discussion today. We will be having further discussions on such topics. Thank you.
Thank you.